Santhathi Fertility and Maternity Center presence. Santhathi is dedicated to providing comprehensive care for patients struggling with infertility and other reproductive endocrinology problems. We offer a full range of infertility diagnostic testing and assisted reproductive technologies including IVF. Our fertility experts and staff are dedicated to giving you the highest level of care and compassion. We use personalized and proven approach to provide both comprehensive and consistent planning toward the diagnosis and treatment of gynecologic and fertility issues. Services ** intrauterine insemination, IUI, * in vitro fertilization, IVF, * blastocyst transfer * frozen embryo transfer * fertility preservation * sperm freezing. Intrauterine insemination, IUI. IUI stands for intrauterine insemination. During this procedure, men's semen sample is processed and the obtained sperm sample being placed directly inside the uterus. IUI is a technique to overcome a variety of mild fertility problems, many of them on the male side. IUI is also often performed in cases of so-called unexplained infertility by many fertility specialists. Male infertility indications for IUI are low sperm count, low sperm motility, cervical factor, infertility, sexual dysfunction. When the male partner's sperm count is low, his sperm have a lower chance of fertilizing the egg, simply because there aren't as many sperm. Similarly, when the male has sperm that has too little motility to swim on its own up vagina, uterus, and fallopian tube to the egg, sperm is unlikely to reach and fertilize the egg. By placing sperm directly into the uterus by an IUI, the greatest barrier, the mucus in the cervix, is bypassed, and sperm does not have to travel so far to meet the egg in the fallopian tube. Therefore, more sperm reaches the egg, creating a better chance of fertilization for the egg. IUI is usually combined with ovulation induction, a process in which a woman's ovaries are mildly stimulated. Mild ovarian stimulation is a good idea in an IUI cycle, because ovarian stimulation encourages the ovaries to produce more than one mature egg. Having more than one mature egg means that the sperm used in IUI have a better chance of meeting an egg and fertilizing it. Ovulation induction with IUI, however, also creates a risk for multiple births. When the ovaries have a good number of mature eggs, a hormonal injection, HCG, is used to trigger ovulation, release of the eggs from the ovaries. This injection determines when the patient ovulates. Inseminations are timed accordingly. We inseminate twice every month in most cases, once just before, and a second time just after ovulation on consecutive days. The main risk for IUI is the risk of multiple gestations, especially of high-order multiples, triplets or more. This is an inherent risk that is extremely difficult to avoid. The difficulty lies in the fact that the physician does not have good control over how many eggs are released at the time of ovulation, and how many of those eggs are fertilized by the semen from the IUI. Physicians try to strike the right balance between good pregnancy chance and a low risk for multiple gestations, but even in best of hands, high-order multiples will happen. Fertility practice has come to try to avoid multiple births, especially high-order multiples, because they carry elevated risks, especially of premature delivery. The goal of good infertility treatment is, of course, not only to achieve pregnancy but to achieve pregnancy responsibly, and with as low risk as possible to mother and newborn children. In vitro fertilization, IVF. With the advancement of modern science in the last few decades, assisted reproduction has become a successful and common course of treatment for infertile individuals and couples. In vitro fertilization, IVF, is one such assisted reproductive technique that has been employed successfully as a solution to a range of infertility issues. The IVF process is both safe and effective, and it has been used in the early 1980s in helping infertile individuals and couples achieve their goal of becoming parents. There are two options are available in the lab. The first is routine IVF, where the washed sperm is added in a measured quantity to each dish containing an egg. This method requires numerous amounts of motile sperm from the male. The second is ICSI, which is recommended when either the quality or the quantity of sperm is low. ICSI is also useful when the zona pellucida, the membrane surrounding the egg, is so thick that the sperm cannot penetrate on its own and requires forced injection. Done under a high-powered microscope, ICSI involves selecting one sperm and injecting it into an egg. Both IVF and ICSI procedures are carried out by the well-experienced in-house embryologist, who is a backbone of an art center. Fertility practice has come to try to avoid multiple births, especially high-order multiples, because they carry elevated risks, especially of premature delivery. The goal of good infertility treatment is, of course, not only to achieve pregnancy but to achieve pregnancy responsibly, and with as low risk as possible to mother and newborn children. Day 1, check for fertilization. Day 2, monitor growth. Day 3, monitoring of embryo development. Day 3, assisted hatching. Day 3, pre-implantation genetic diagnosis. Day 5 to 6, blastocyst transfer. One of the great advantages of IVF is that it can treat many causes of infertility. These conditions include tubal blockage, problems with ovulation, problems with the way the sperm and egg interact, poor sperm quality or quantity, older patients, problems with the cervix, and many more. Another great advantage of IVF is that it can be used to make specific diagnosis. Since the embryo is created in the lab, it gives specialists the ability to test the embryos for any genetic or chromosomal problems. IVF therefore can be used to diagnose inheritable diseases. Some of the most common diseases tested are cystic fibrosis, sickle cell disease, and chromosomal problems such as Downs' syndrome and Turner's syndrome. Blastocyst transfer. After the fertilization process in fallopian tubes, human embryo enters uterus for blastocyst process. Whereas in blastocyst transfer, embryo will be cultured outside in the laboratory, and when it reaches blastocyst stage, that is 5 to 6 days old, it will be transferred into woman uterus. Once it is transferred to uterus, it begins to implant into uterus wall endometrium and undergoes development process. As developed embryo is transferred to womb, natural process of implanting with the uterus wall and development process continues from here. In IVF, 4 days embryo will be transferred, whereas in blastocyst transfer, 5 to 6 days embryo will be transferred. Hence the success rate of blastocyst transfer is high compared to IVF. Frozen embryo transfer. Many couples end up with having more embryos after IVF process. These embryos can be frozen safely and can be used for future pregnancies or can be given for adoption. When partners are unable to conceive, they can adopt embryos from other couples who have already frozen them. Embryos will be cryopreserved by freezing in liquid nitrogen and can be stored for years. After detailed ultrasound diagnosis of uterus to make sure no cysts or other structural issues are present. 2 natural hormones, estrogen and progesterone medications, will be prescribed during regular menstrual cycle to thicken the uterus lining for implantation. Ultrasound monitoring is performed to examine the lining of uterus. After the couple of weeks of preparation, embryo will be thawed and prepared for transfer. This procedure is known as frozen embryo transfer, FET. FET process is easy, requires less medication and is less stressful compared to new IVF cycle. After embryo transfer, the same IVF treatment will be processed. Fertility preservation. Fertility screening and preservation planning for the future. There are few individuals, male or female, that don't think at some point in their lives about having children and raising a family. It is hardwired in the human genetic code. However, it has become increasingly more common to get distracted in life from these thoughts of procreation and family, pushing them out of our minds while we occupy ourselves with career and other various activities. Invariably, however, the idea of childbearing comes back. In the field of reproductive medicine, there are viable emerging techniques and technologies for egg freezing or cryopreservation. These technologies have recently undergone significant advances that dramatically improve live birth rates. We can now cryopreserve eggs for patients that are undergoing potentially damaging ovarian surgery and provide egg freezing for cancer patients prior to undergoing chemotherapy. These techniques also make it possible to freeze and store eggs for those that wish to preserve fertility or postpone childbearing for other personal reasons. Embryo banking vitrification has opened up new possibilities for IVF treatment and fertility preservation. One dilemma that women face when considering IVF at a later age is the fact that they generally have fewer eggs available, and of those, a higher percentage are chromosomally abnormal. A new option that has great promise for halting the biological clock and aiding these women in conception is embryo banking. The basic premise is as follows: a woman undergoes 2 to 3 consecutive IVF stimulation and egg retrieval cycles without an embryo transfer. After each retrieval, the eggs/embryos are biopsied and frozen and the competent eggs/embryos are identified. The woman then schedules her embryo transfer using 1 or 2 of the competent embryos. This optimizes her chances of success, while minimizing the cost of testing and treatment. Egg freezing: women who want to preserve their fertility for reasons of cancer treatment, career, or other personal choice, have faced a difficult barrier due to the poor success rates for egg freezing. Pregnancy rates for women using frozen/thawed eggs have been less than 4% for each individual egg frozen. Sperm freezing. We at Santhathi Test Tube Baby Center is serving with sincere care. We welcome visitors to come forward and have a counseling session with us before considering donor sperm program. We would like to provide much information for the benefit of visitors. Center is equipped with best counselor to carry out counseling session. Icsi sperm injection, which stands for intracytoplasmic sperm injection, involves the direct injection of a single sperm into each egg under direct microscopic vision. The introduction of Icsi has made it possible to fertilize eggs with sperm derived from men with the severest degrees of male infertility, and in the process, contact us for further information. Thank you.